Our next speaker is Dr. Witkos. He is one of our conference sponsors from Unisoc External Catheter. And just interesting, Dr. Witkos is advancing a protocol for elderly patient abandonment in the ER, supported through the John A. Hartford Foundation National Collaboratory to address elder mistreatment, a very serious issue in our society. As Chief Medical Officer at Alpep and Easy Bedpans, he is focused on developing devices that ease the burden of care experienced by frontline healthcare workers and families taking care of their loved ones. I love this sentence. He utilizes direct nursing input. Please help me welcome Dr. Witkos. Thank you.
Morning. My name is Maciej. Outside of the hospital, I just prefer if people, if people just prefer to call me by my first name. I just wanted to say I really enjoyed Ms. Caffey's presentation. I think she spoke about a couple of things that it's not just nursing, but all professions and people in general need to engage in. And that is communication and being more thoughtful of other people and trying to talk to each other. We need that sense of the belonging. And it actually, I think, touches on another topic that we will actually talk a little bit about this, which might surprise some people, but the issue of dignity. Dignity is actually pretty important for people. So I do want to say I am humbled to be here. I actually started off in healthcare as a nurse assistant. So I'm very well and intimately familiar with some of the more unglamorous components of healthcare and nursing care, the parts that are never really shown on any of the TV shows, because it's really not that sexy. But it is literally the bread and butter of care. So without further ado, I'm going to present our survey, a study on our Unisoc external catheter system and how we compared it to other devices, predominantly the PureWorks system. So if I could have the next slide, or do I control it with this? Green button, thank you. Okay, so I'm going to talk a little bit about the issue at hand. As we're all aware, we're getting more and more geriatric patients, and it is becoming a greater and greater component of all care, including emergency care. And that's why in our department, we actually changed it to be certified as a geriatric emergency department in one of them. That's why we're so engaged with other causes, such as trying to figure out what to do with patients who are abandoned in the ER. And this happens sometimes, unfortunately, even for good reasons, where the family is just so dysfunctional, they don't know how to take care of somebody. So it's almost like a benign abandonment, but we do have to have protocols for it. But everybody's getting older. And one of the biggest problems, and again, this is something nobody wants to talk about, is urinary incontinence. And it is one of the biggest issues that affects people. Up to 50% of women already have this as they get older. And it affects your quality of life. And besides all the morbidities that can occur, urinary tract infections, any urinary incontinence associated dermatitis, it actually touches upon the issue of dignity. When you start having issues where you're feeling wet, you start feeling more socially awkward, and you start actually withdrawing. And you lose that sense of belonging when you can no longer hang out with your friends, or you don't want to, rather, because you feel embarrassed. Now, in the hospital, I don't discharge patients from long-term care. I discharge them from the ER, but I know from the long-term stays in the internal medicine department or other departments, patients still have urinary incontinence when they get discharged. And unfortunately, from my conversations with discharge planners, some of the discharge nurses, and some of the physicians, this is not a topic that people discuss. They don't talk about what equipment is out there, what options are for the patients, and they just let them go on their merry way. So the Unisoc external catheter is actually a very good choice for this. And I'm not trying to sell you here anything. I'm just saying it's one of the options out there. And it's a system that's non-invasive and is reusable for most patients and quite comfortable, and that can be used. What we did is, that's how it looks like. You can see one outside if you care to. It was developed by Alvin. He was a nurse. We sent out a survey to all our customers that are buying our Unisoc system. And we have quite a few customers. We interviewed over 100 of them through our survey, and we're continuing to do so. So our number is growing. It was completed between May and October 2024, so it wasn't long ago. It's fairly fresh. We included questions that were demographic and clinical, and satisfaction and other aspects of their care, and we scored it on a Likert scale. 5 being the best, 1 being the worst. Make it nice and straightforward. And the care we asked the patients and the caregivers both. So this way it prevents the wiki hickeys that you can have. All the other devices out there, PrimaFit, the new Medline device that literally looks like a flattened sausage. I mean, looks like a Spam cut in half. Also, I'm sorry, I'm making all these references to food, but that's literally what they look like to me. It looks like a plaster that goes like this, and again, it starts sucking on your skin. Whereas the Unisoc actually suctions air. So when a person pees, the pee goes through here. It goes through a wicking material and is basically captured in this diaper-like cloth, which is permeable only this way, and then it all trickles down here and it's suctioned down here, which also prevents the fecal matter from coming up, because the fecal matter, sometimes if you have a PureWick or something else, the suction will actually cause a current, or for lack of a better word, of material traveling up. With this, the suction is down here. There's literally a blockage on the perineum preventing E. coli and other bacteria traveling up. And the suction going this way actually causes air to travel down. So it actually dries the skin and prevents the bacteria from traveling up. It actually goes down. So everything is going down into the receptacle where it gets collected and sucked out. So, but we were presenting at the NPIAP conference here in Dallas a couple of weeks ago, and we were just literally talking about this. And I really hope that when we do the studies in the facilities like nursing homes or hospitals, we actually look at that, because I mean, I don't know if I don't know, this is again not a very sexy topic, but more people die from pressure injuries per year than from car accidents in the US. And this is one of the first ways. Anyways, questions?
Just kind of to piggyback off of what she was asking, I'm wondering about bariatric population specifically. We've used both of your competitors' products out there, and they just don't work very well for bariatric patients just because of their anatomy. So I'm curious if you have any data on your product with that population.
So we don't have the weight and BMIs of the patients that we have. We do have, again, in this comments section, a lot of the patients describe how they've used PureWick before, and then they switched over to us. And one of the things about this is the fact that this is completely malleable. So if you're very skinny, you can actually decrease the width of it and actually decrease the angle. But if you're larger, a bariatric patient, you can actually open this up. Or if, let's say, you have edema, or you have scrotal swelling if you're a male from anasarca, or if let's say you're a female and unfortunately you have some form of radiation treatment or something, and you have quite a bit of edema in the lower abdomen, this will actually it's malleable enough that you can actually fit the person to it. It's not to sound weird, but it actually works better with obese patients sometimes, because you don't even need to put on underwear on them. You just kind of put it in there. For lack of a better word, you put kind of their thighs over it and it just sticks it in place. Whereas if you're skinny, you kind of need to have underwear on. Sorry, any other questions? Yeah, we do. If you want to. So not to sound too weird, but we're very keen on this, and we actually tested it out. One of our guys actually drove in one of these from San Diego all the way to San Francisco to make sure it wouldn't leak. We are dedicated. It works. Yep. Yeah. Well, actually, that's why our pump has a battery in it. So if somebody if it works great for cars, but it also works if a patient's on a wheelchair or if they get physical therapy, so they can actually wear this while they get this. So this way they don't have to worry about it. Or let's say you want to take grandpa to his granddaughter's graduation or something of that nature. Basically, yeah, it would work great. So yes. So one of the guys that one of the gentlemen that owns a medical device equipment store wants to sell it to pilots that drive single seater lanes because he says this is perfect for them. They can just put it in the plane and just actually enjoy themselves instead of trying to do things in flight. And I was like, it wasn't, yeah. So if you anybody, oh yes, so yeah. Uh-huh. Our this suction so we have a you can hook it up to any suction you want, by the way. You don't have to go with our our suction. Ours is just quieter. It's called the Whisper, and it's much better if you have somebody that's sensitive to sound and you want them to have a good night's sleep. However, you can hook it up to your wall suction. You can hook it up to PureWick's or BD's suction. You can hook it up to any suction you want. It doesn't matter. In terms of I's and O's, right there, you get all your I's and O's. It will get everything out and go straight into the canister. So you can measure it. Oh, well, so we have very little leakage with this. I mean, it might be like 5 ml at most. I mean, it's again, I'm not trying to be weird, but we ask our patients a lot because we're small, and again, we're healthcare providers. Our main goal is actually to provide the best care. So we call them and we ask them, I'm like, hey, what's the problem with leakage? And if there's a problem with leakage, it usually is a question of just educating them. Some people just smack it on them and they never actually curve it. Once you curve it and you prevent the space between the perineum and the device, there really isn't that much leakage. It's minimal again. That's why I would say it's like maybe 5 mLs. If you know what I'll do? Once we finish with the conference, I'll go and make one completely wet and I'll weigh it and I'll let you guys know how much. I mean, that's a valid question because I'm sure more people are going to ask. So I'm happy to check. I mean, if we're going to talk about data, then we have to have real data. We'll check it today. Yes, ma'am. Mhm.
Function?
Oh yeah. So we actually, and this is again from our feedback we got from our providers that people that are using this, we actually supply a mesh underwear because were talking about the fact fidgeting or somebody has Parkinson's disease or some form of other neurological dysfunction. So we provide it and it just keeps it better in place. So some people like to even put a diaper on top if they have fecal incontinence at the same time. So this way the diaper keeps this for the urine, and if there's a problem with fecal incontinence, they capture that too. So, and unlike PureWick or the other devices out there, when somebody's fecal incontinent, this doesn't suction the poop up, which does happen with the other ones. So, sorry. Oh, yes, one question.
What's the ratio of males to female as far as satisfaction?
Uh, I did not break down the data based in terms of satisfaction by gender, but if you want, if you give me your email address, I'll send you that today. I mean, we just looked we only have 100 patients responding so far. So, I mean, and predominantly they were female, but I can get you that information if anybody else wants. Just let me know.